Thanks, Brian. Well, there have been some exciting changes to the role pharmacists play in Ontario's healthcare system. Here with the details is Phil Hauser from Hauser's Healthcare. Good morning, Phil. Thanks so much for being here today.
Good morning.
So let's go over some of those changes that have been made here in the province.
Sure. As of the beginning of the year, pharmacists' role in common ailment prescribing, we've gained 6 new conditions that we've been able to kind of prescribe for, on top of the 13 that we had the ability to do since 2022. So that makes 19 in total, but we still feel there's more capacity within the healthcare system and more opportunity for pharmacists to be able to prescribe for these things, and more need from our patients. So we're pushing for more things as well.
Okay, so for example, let's put forward something. Let's say if you did have strep throat, for example, something like that, is that something that a pharmacist would be able to help you with at this point in time?
So strep throat is actually one of the ones that we're pushing for. So things like sore throats, birth control, and a few other things that we think are really important for our patients. But strep throat right now, there have been some pilot projects on strep throat, but right now we try to focus on things like urinary tract infections, conjunctivitis or pink eye, acid reflux, things like menstrual pain, yeast infections, and even morning sickness in pregnancy.
All right, so what would the steps look like? Someone would just go straight to the pharmacy desk and ask more questions there. How would that process look?
Yeah, well, pharmacists are one of the most accessible healthcare professionals out there, and for most pharmacies, and you know, the last time I was on here, we talked about the toolbox that pharmacists should have on board, and what you should look for in a good pharmacy. Pharmacists should be accessible to be able to have that minor ailment or have that common ailment conversation, or even if they take you into another room and do the assessment, it should happen fairly rapidly. If they're telling, you know, the whole point of being accessible is to make sure that you don't have to wait 4 hours in an urgent care, you don't have to go to an ER, you don't have to wait a couple of days to see your family doctor, because we know that they're very busy. The idea is that you can see your pharmacist that same day, hopefully within the hour. Certainly at Hauser's Pharmacy, that's the case.
And something, like you mentioned, kind of alleviates that stress that we're seeing on our healthcare system right now. But Ontario isn't the only province that's making these changes, correct?
That's absolutely correct. And you know, what we're seeing in some of the other provinces is looking at pharmacists as a viable option to create more capacity within the healthcare system. So we've seen new legislation tabled in Quebec, and we're seeing our scope of practice pushed in provinces like Nova Scotia, where pharmacists are actually prescribing and taking care of particular disease states. So something like if you were a newly diagnosed diabetic, you'd be able to kind of walk through some of the different regimes and different medications with your pharmacist without having to see your family doctor. So we're hoping to get to that stage in Ontario. Very exciting stuff, though.
So next steps leading into that, as a pharmacist yourself, what are you guys hoping to see in the future when it comes to Ontario, and what the steps they're taking going forward?
Oh, absolutely. I think that we've got a tremendous capacity and a great set of pharmacists in Ontario, but the opportunity for us is to expand on some of these, but also to continue to push. So when we saw pharmacists first get injections, there's still a lot of room that we can do with injections, the prescribing factor, and even moving beyond simply just the active dispensing and getting into these one-on-one patient conversations and solving those problems rather than having to refer. So tremendous opportunity for us, for sure.
Phil, appreciate your insights on this today. Definitely an exciting movement towards the future for pharmacists and where people can get their healthcare taken care of, for sure. We have all those details available for you on our website at chch.com. Stay with us for more right after this.